So I'd like to conclude this presentation with going over all the different things we covered. With chronic myofascial pain, whether it's regional, of the low back, mid-back, neck, shoulder, or global throughout the body, as in fibromyalgia, you need to take a holistic approach to truly rehabilitate your pain. We can try to cover up and mask the pain with drugs, but as recent news has shown us, we tend to only cause more problems, such as GI bleeding or heart attacks. A comprehensive program to rehabilitate our myofascial pain involves first deactivating all active and, as I've said, latent trigger points. Latent means quiet. They're not spontaneously generating pain. Of course, go after the ones that do spontaneously generate pain, but then search out from there to check out any latent trigger points which may be facilitating your nervous system and setting you up for a return of the active pain. And the easiest and best way to do this is with the FENIX Rehab System. It is one of the most efficient ways. It has the most variability of treatment, and you can relax instead of having to tighten up muscles as with handheld items and other products. You can relax the muscle to fully, truly deactivate the trigger point. The second point is to be very disciplined to work on your myofascial trigger points, all active and latent trigger points, on a consistent basis, daily or every other day in the beginning, until we begin to lessen their impact on our health, on our body, on our pain. They are facilitating the nervous system, and you need to consistently, over time, in a sense, bring them back or rehabilitate them to more normal tissue, and this takes effort. Some individuals like deep pressure and like it every other day with the FENIX Rehab System. Others find that they only can withstand a very light pressure and need to have a day of rest in between. You find out what works best for you, what works best for your myofascial trigger points. We also need to be disciplined about stretching. Many times when therapists do trigger point therapy, they don't take the time to stretch the myofascial tissue after. And the work of Janet Ravel found that unless we stretch the myofascial tissue after doing trigger point therapy, the myofascial trigger point will not release. It will come back. Then it's important to work on improving our muscle strength through the use of an exercise ball, as we talked about, and resistance tubing products to strengthen the extremities or strengthen the core muscles of the low back, front and back. So utilize these products too to improve the strength. Now, all these products that we've been talking about so far, FENIX Rehab Systems, the Lotus Point, the full-size system, the book, the Trigger Point Therapy Workbook, the exercise body ball, the resistance tubing, all can be purchased through the FENIX Recovery Enterprises. And we'll give you that number and website at the end of this presentation. Now, you can also help yourself by improving your diet. Increase your intake of fruits and vegetables, eat more organic, and add specific nutraceuticals. It's also helpful to add a multivitamin mineral and supplement with omega-3 fatty acids, 3 to 6 grams, to produce a better wellness and to reduce inflammation and minor pain. Then you can also add in magnesium malate to help promote muscle relaxation and reduce muscle tension and tenderness. This also helps to increase energy. Remember to use at least 300 milligrams of magnesium and 1,200 milligrams of malate.